Hello everyone, this is Torsha and I'm back with another informative session at Tiyo. And today we have Dr. Sujoy Dasgupta. He's one of the most celebrated gynecologists in Kolkata, and we've had some wonderful sessions with him already. And today we'll be talking about another important part of our life, and he'll be telling you more about it.
So, today our topic of discussion will be the common problems faced by people in their day-to-day conjugal life.
Yes, and I have a few queries which sir will be answering. So the first query that I have is, what do people really face as in commonly about the problems in their conjugal life? What problems do they come for most of the times?
Okay, different people come with different presentations. Usually, many people come with complaint of low desire, or sometimes the men or women themselves present, or sometimes their partner complain that they are not feeling any interest in intercourse. Secondly, sometimes, particularly in women, it's very common to feel some pain and bleeding during intercourse, and that's why they want to avoid intercourse. Sometimes a men feel problem, and it's very common for many of the men to feel problems with erection or particularly maintaining the erection during sex. And quite usually, many of the men are not satisfied with the timing of ejaculation, that is, they complain of premature ejaculation. And although rarely, some men come with not having ejaculation at all. So these are the common problems usually people face in their day-to-day life.
Okay. Uh, are these problems really growing with every passing year, you think? And what are the reasons behind it?
One reason is the awareness. Earlier, what happened, that people used to hide these problems. They used to feel ashamed and they didn't consult doctors.
Right.
Nowadays, people are coming, but at the same time, the problem is also increasing because of our lifestyle, increased amount of smoking, alcohol intake, sedentary lifestyle, that is not doing exercise, excessive weight gain, and some medical problems like diabetes, hypertension, these things are increasing.
Right.
Another thing is the stress, because in modern day-to-day life, stress is very much affecting people's life. And I've seen some professions are particularly liable to it, particularly the people working in IT sectors, the software engineers, some lawyers, some teachers, some businessmen, corporate sector workers. They are very much badly affected, and particularly the shift workers. And along with it, some previous bad experience with intercourse can make the situation from bad to worse. Like previously, if some couple face some difficulty, they want to avoid intercourse.
Okay.
So that's why I think the problem is increasing day by day.
Okay. When I was, kind of researching about it, I came across this term called low libido. So, can you just please explain to us how it is important in this context?
Okay. Libido simply means the desire of having sex, the excitement. Okay. There are very many people who cannot feel this libido, that is, they feel less attraction or less interest in sex. It's quite common in men and women, although sometimes men or women are themselves coming with it, or sometimes their partners are coming saying that my partner is not having adequate interest. Okay, the reason may be again the lifestyle changes that I've already told, the stress, alcohol, obesity, but sometimes some psychological factors may be there. Sometimes some fear of having intercourse, like factors related to bleeding, factor related to pain, previous pain, or sometimes previous poor performance, like if a man felt repeated failure in erection previously, then he will not feel interested in intercourse, that is, he will try to avoid intercourse.
Right.
And of course, some physical illnesses that I have already said, that hormonal deficiency, hormonal imbalance, diabetes, hypertension, that is increased blood sugar, increased blood pressure, and some medicines, they can sometimes cause this low libido.
Okay. Again, while researching, I got under this confusion that whether it pains really badly during, before, or after intercourse. So I want to know exactly what happens. Is it normal for people to feel that pain during or after intercourse?
Many women are particularly scared that first time intercourse will be very much painful.
Right.
It's not the fact.
Right.
Well, some discomfort may be there during first intercourse. With passage of time, it usually disappears.
Right.
But and some discomfort may be there initially, but if a woman continuously complains of having pain, it should be taken seriously because it may be related to vaginal dryness because there is lack of lubrication. Secondly, it may be related to some diseases like some infection in the genital tract, some diseases like some sexually transmitted infections, some disease called PID, pelvic inflammatory disease, that is disease or infection inside the ovary, inside the tube, inside the uterus. And sometimes there is a disease called endometriosis. That is what happens, the endometrium, that is the tissue what lines the uterus, may be found outside the uterus. And during intercourse, if the penis hits those areas, the woman may feel pain. So this should be taken seriously. And again, some women may feel a disease called vaginismus. That is, there is no disease actually, but they are under fear, and so they usually tighten their thighs or the vagina, so they cannot simply relax. But sometimes men may also feel some pain, and it's not very common for men to feel pain, so they should take it seriously. One condition is phimosis, that is the foreskin of penis, which should move forwards and backwards easily. Sometimes it cannot move. Many men have an idea, that is a wrong idea, that with intercourse it will move. It's not. If there is phimosis, it must be treated. Secondly, some men may have some injury during intercourse, like fracture of penis, which may present with swelling, sudden onset swelling after intercourse. Sometimes there may be a tear in the penis called frenular tear. Frenulum is a part of penis where there is a common injury. And again, if there is infection in penis, men may also feel pain. So if any one of the partner feels pain, it should be taken seriously and they should consult a doctor. We usually try to find out what the causes and then we give the treatment.
Also, is it okay for somebody to bleed during intercourse? As in, there were several cases that I've read online, as well as I've been told that bleeding for women during intercourse is, for the first time when they are having the intercourse, it's common. So is it so?
I will again say it's totally wrong that always women should bleed in first intercourse. Okay, some bleeding, slight spotting can happen, but it should not last longer. Okay, if it lasts longer, then we have to think about whether there is any serious injury during intercourse, which is quite common during first intercourse. Sometimes women may feel bleeding and experience bleeding repeatedly in each and every attempt of intercourse. It should be taken seriously, particularly in older women where it may be due to cervical cancer. Sometimes it may be due to some infection, like some sexually transmitted infection, particularly chlamydia. Sometimes it may be due to some polyp, that is a fleshy mass coming through the cervix, or sometimes it may be due to some abnormal position. So what happens, we usually ask the women to come, we examine them. Sometimes we have to take some swab, that is with the cotton, we examine the area and send the sample to see whether there is any infection or there is any abnormal cells present there or not. And sometimes the men may also feel bleeding, again due to same reasons, due to phimosis, due to infection, or due to some injury in the penis. So we have to take them seriously, and the treatment depends on the cause.
Also, there are some men who really complain about the fact that they don't get any erection. So what should they do about it?
What these men commonly do is that they commonly go to the shop and they buy some tablets and try to solve this problem. It's not at all a healthy practice, because sometimes this problem of erection may be an early sign of having heart disease, diabetes, some diseases in the nerve, some diseases in the blood. So you know that there are many men who didn't know that they are actually diabetic. They presented with erectile dysfunction, and while testing the blood sugar, we found that they are high diabetic. Sometimes it may be due to some hormonal problems, particularly problems due to low testosterone, high prolactin, abnormal thyroid function. So what they should do? They should consult a doctor, like keeping aside all their discomfort. Okay. So what we'll do? We consult them. If necessary, we examine them. We give them some advice. We try to find out the cause, and finally we give some medicines. It usually responds very well to treatment. So there is no reason that you should not consult doctor for this problem.
Right. How common is this issue among men, as in um, the problems related to ejaculation?
Okay. Majority of the men are coming to us saying that they are having premature ejaculation. That is, they feel that the ejaculation time is not perfect. It actually depends on the concept, that is, how realistic his or the man's expectation is. To some men, 5 minutes is okay. To some men, 10 minutes is not alright. We treat it as seriously when the man says that he ejaculates before penetration or he ejaculates within 1 minute of penetration. Of course, we try to find out the cause and then we give some medicines, but often no medicine is required. It can result with some techniques, some exercises, and some tricks. But uncommonly, there are some men who come with anejaculation, that is, they are not able to ejaculate during intercourse. One reason is that retrograde ejaculation, that is, the sperm, instead of coming forwards, the sperms go backwards into the bladder. It may be related to some surgery, particularly surgery of hernia, some complex surgery in abdomen, diabetes, infection, or some nerve problems. In these cases, they are very difficult to treat, but one thing we can assure that if the sperms are found in the bladder, that is in the urine, we can treat them, that is, if they want pregnancy, it's very well treatable conditions. That is, we can do IUI or we can do IVF to give them pregnancy. But there are some men who are having masturbation, they can ejaculate during masturbation, they are having nightfall, but they cannot ejaculate simply during intercourse. It may be due to lack of proper positioning or sometimes due to lack of sensitivity. It usually does not respond well to medicines. It may need some exercise, some sex therapies, but again, if they want pregnancy, it can be easily treatable with the help of IUI. Even sometimes IUI is not needed. They can themselves try with self-insemination, that is, they can collect the semen by masturbation and they can put the sperm inside the vagina as an alternative to intercourse. So these are the common things usually men face with ejaculation.
So that's about all the queries that I have, and now you know exactly what to do. That is not being uncomfortable about talking regarding these issues, and you will always have Tiyo and Dr. Dasgupta to always answer your queries about it. So just follow us on Facebook, Twitter, Instagram, YouTube, and we'll be back with another informative session very soon. So bye guys.